Okay, welcome back and Happy New Year, everyone. I appreciate you joining in today for this webinar on BIOFLEX Personal Therapy Systems and how they might be used to prevent and treat low back pain. The reason why I chose this topic is actually funny enough, a good month and a half ago when I was choosing the topic, we had tons of snow up here and around the Toronto area and Buffalo and everywhere else probably. And now it's like everything's melted. There's probably not as much snow, but I'm sure it'll be coming. It's not just about, snow shoveling and back pain, but that's certainly one of the most common causes of back pain. So those of you who have not attended before, this webinar will be recorded, and as long as you register for any of my webinars, you'll be sent a link to watch it once it's edited, to watch it whenever you'd like as well. So if you have to leave early or for future webinars, they are recorded and you can watch them later as well. Of course, in a live format, you can ask me questions, and I certainly encourage questions. I already see one on osteoporosis, and I'll definitely get to that at the end of the webinar when I get to all the questions that you might have as well. So I'm the medical director here at BIOFLEX Laser Therapy based out of Toronto, Ontario, Canada. And I've been doing this for well over a decade now. My profession, actually my background is in molecular biology, molecular genetics at a graduate level. And then funny enough, I became a chiropractor and I practiced for 30 years. And during that whole process, I started to do different interventions, obviously manipulation and acupuncture and all sorts of different things. And eventually, on a personal note, I ended up trying laser therapy for an injury I had falling off a roof. And lo and behold, it really helped. And that was about maybe 12 years ago, 13 years ago. I'd never used it in clinical practice. I didn't really know much about it. And that got me interested in my journey, and it was sort of started from there. And as I learned more and more about how it works and why it works, and then what seemingly seemed like an endless amount of research, I got a lot more interested in it and started to use it clinically. And so that's kind of where I am now. We manufacture now we're a manufacturer. We're also a clinically based company. So we started off as a clinic and eventually started to make the equipment and distribute it throughout the world. But first and foremost, there's a lot of clinicians involved with this company, and our goal is to help people with their injuries and their conditions. So using photobiomodulation. So we feel that we have a lot of expertise in this field. Of course, it's become a lot more popular, especially when you hear terminology like red light therapy and cold laser therapy. And really, unfortunately, there's a lot of misinformation. And I use that word kindly because oftentimes you're dealing with companies that aren't a medical device company like ourselves are, or a high class medical device company like we are, where we can't just go out and say lots of things that aren't true, because we have not only a responsibility, but we're audited by the FDA and Health Canada. So we say accurate things. Otherwise, we get shut down, unlike most companies out there. So I try and keep this pretty scientific, within reason, and follow the research within reason, along with clinical anecdotes, of course. But everyone needs to understand that if this is going to work for you, you need to understand how it's going to work, and you need to understand the equipment that you're using and how it's used and everything else. So that's essentially how where I'm coming from. So today we're going to talk a little bit. I always introduce our systems because we always have new people that are listening in for the first time. And then I'll briefly talk about what this whole concept of photobiomodulation therapy is. I know there's a lot of naysayers or people that just don't understand it, or they maybe just want a little bit more information. And then I'm going to talk about back pain, a little overview of back pain. Obviously, it's an exhaustive topic, but I'm going to talk a little bit more about what's called non-specific back pain. The kind of back pain you get after shoveling snow or lifting something, or that kind of thing. Although it sounds like it's a weird term, non-specific. That's because there's so many things that can cause it. But in general, there's one common theme, and I'll talk about that. So that's kind of where I'm focusing today, not so much on like herniated discs and and degenerative issues, that kind of stuff. I can talk about that another time, or I probably have. And then I'll talk a little bit about sort of not so much about laser therapy or photobiomodulation, but just in general, what you can do to prevent back pain. And believe you me, there's lots of things you can do that are proven. And unfortunately, there's lots of things out there that are not proven. And I may not recommend because that's not what the research says. And then I'll get into BIOFLEX, the personal systems, and what I'd recommend to how to use them both to treat back pain, but also to prevent back pain. So, and then we'll have time for Q&A at the end. We may run a little bit over time. Typically we do. They tend to go up to close to 1 o'clock, although it's scheduled for 30 minutes. Our systems look something like this. There are 2 different sizes, a personal 120 or 180. That's just the number of diodes that are in the equipment. Be very wary of equipment that says they're lasers. And by the way, laser therapy is a misnomer. It doesn't have to be a laser diode. And if it's a laser diode of anywhere greater than 5 milliwatts of power, legally, you shouldn't be able to buy that thing because there's lots of issues with safety. So we also know that using high-powered LEDs, especially if they're right wavelength and narrow band and powerful enough, and you have enough of them, you can also have this same healing effect. And sometimes it's actually more effective because you're treating a much larger volume of tissue. So that's what our devices are about for home use. Of course, for professional use, we also include lasers because healthcare professionals can take the training and it's within their scope of practice to purchase these things. So that's sort of where things are at there. And by the way, if you do buy home devices that say they're lasers and they claim it's very powerful, it's not. By the time it hits the skin, usually the diode is set back quite a distance so that the actual power is much, much weaker. They won't tell you that because they just want to not be honest or truthful. But end of the day, if they were to use anything more powerful than 5 milliwatts, it's illegal, and also it can be damaging for different reasons. So the equipment has a controller that has, different anatomical points, depending on what you're treating as well. Of course, the treatment area of the pad looks something like this. We're the only company that actually makes what's called bicolor LEDs or superluminous diodes. That is, each diode can produce 2 different wavelengths in not at the same time, but in sequence. This allows you to have a much greater energy density of light in a surface area because they can pack them closer together, as opposed to having alternate red or near infrared diodes, which spread out the surface area for treatment as well. So how therapy works and how it usually almost always works for these devices is when you first turn it on and apply it, red light will be emitted. It's a little hard to tell you here, to show you here, but you can see the red light, and it goes relatively superficial. It depends on the density, the skin color, all sorts of different variables there. But essentially, red light is going to penetrate from a few millimeters to a centimeter. To be effective, that is, it might go a little bit deeper, but to be effective, it's going to be in that range. So, you can treat lots of different things there, but it's not going to go super deep. For a little bit deeper areas, you want to use near infrared in anywhere from 780 nanometers to low 800 nanometers is typically what's used in photobiomodulation. Or sometimes you see a little bit higher, and that has certain benefits. But as you get away from the mid 800 nanometers, the effectiveness is lessened because of different reasons, which I won't get into right now. But the near infrared is more transparent. It can go deeper into the tissues. How deep, again, you can't say. There's variabilities there, but certainly several centimeters more than likely. So you can get to a lot of tissues a little bit more easily with infrared. Now, red is a better wavelength because it's absorbed better by what you're trying to target, but it's superficial. So therefore, near infrared, not quite as good, but still good, allows you to go a little bit deeper. And that's why we use the 2 of them. The controller looks something like this, as I mentioned. Of course, today we're interested more in the lower back protocol. So you can see that's the one you're going to be using for today's issues. And there are other buttons like turn power button and stop and start. And then there's one called select stage. And the stage is just a level of stimulation. And by that, I mean both increase in power and also increase in pulsations of light. One power gives you more energy, pulsations gives you more stimulation as far as the light goes, but it doesn't affect the actual power. It affects how the light is absorbed in the cells, in the tissues. The higher the pulse rate, the more stimulation. So how does photobiomodulation therapy? Again, there's a million names for it, but we know a fair amount about it, and we know that there's still a lot to learn. So essentially what happens is when you use these wavelengths, red and near infrared, the light can be absorbed by cells. Now, if it's a normal, healthy cell, it's not going to do a whole lot because the cell's functioning metabolically normally, right? It's when you have cells and tissues that are injured, low back pain, for example, that kind of scenario, and you have inflammation, the cell starts to function poorly. And by that, I mean the metabolism, the ability to produce ATP, or the energy currency of the cell, is reduced. And if it's reduced, that cell has less ability to undergo something called mitosis, or cell turnover, or replication, right? And repair. So the less ATP, or the ability to produce energy, the less ability of that cell to recover and repair. So the goal of the body is to, accelerate that and get that cell feeling better, which most of the time it does. And it takes a certain time frame to do that. Of course, is a million and one things that you can do to maybe increase that or help that to some degree. Some are proven, some are not proven, some are pointless. But if you understand what it is you're doing, you're trying to essentially help the cells and tissues recover faster. And so essentially this light is absorbed, and there's something called a photochemical reaction, very similar, although not the same, as photosynthesis, where the photons, or energy of the sunlight, is converted into from obviously photonic energy into chemical energy through photosynthesis via chlorophyll, allows the plant to grow. So you're actually just converting one form of energy to another form of energy that can be used by the plant. In the case of the human body, we get our energy through eating, not through breathing. Breathing provides oxygen, which you need to produce the energy in the mitochondria of the cells. So eventually you're trying to produce more ATP. And so this light seems to accelerate this process through lots of different mechanisms. Again, I won't get into that, but essentially it seems to actually accelerate the process of making energy in energy depleted cells that are injured or inflamed, and this helps them recover faster. So that's, in a nutshell, that's kind of what you're trying to do. And there's two main ways that the body does this. One is directly. So in other words, I've strained a muscle and I have injured muscle fibers or cells. And then if I shine this light and I get that light absorbed by the injured cell, it can actually help. Unfortunately, we're humans, and we're sometimes big humans or even small humans. End of the day, a lot of these issues are relatively deep. Like if you were to try to reach deep spinal muscles in your spine, it's more than 1 centimeter deep or 2 centimeters deep. Oftentimes it's 3, 4, 5 centimeters deep, where the light can't really reach very well. And then you might say, well, what's the point of using light therapy? Well, another way of using light therapy is an indirect effect. And that is if you expose blood, and specifically circulating white blood cells and stem cells, for a fairly lengthy period of time. I'm not talking for a few seconds, I'm talking for minutes. this blood, it absorbs light, and it has an interesting reaction inside the white blood cells and the stem cells. Number one, it increases their turnover, the ability to replicate, but also it seems to shift them from a pro-inflammatory state to an anti-inflammatory state, which helps to resolve inflammation. Now, of course, this can be carried in your circulation in your blood to deeper areas of your body that might be injured. So therefore, if you treat lots of blood around the area that's problematic and deeper, you can get this indirect or systemic effect in that general area that you're treating. And there's actually quite a bit of interesting and fascinating research that shows this is to be the case. So it works two different ways, indirectly and directly. Let's get into back pain. So, this is a quote from a Lancet paper, and no, it's not. It's from another paper that I'm going to show you, and it's about out of Calgary, actually, in Canada here, and it was about snow shoveling, and it's a really good paper, so I want to share that with you. They quoted in this paper said, a retrospective study has shown that lower back injuries account for 34% of all snow shoveling injuries. So, like, you get out there and you start shoveling the snow and everything, and your back is sore. Like a lot of people, that's what happens, especially with heavy, wet snow. So mind your back. And I'm going to talk a little bit about how you're going to do that. Oops, and it's going to back up a bit. Sorry. There's the reference there, but I have this paper to present very shortly. Okay, so let's talk a little bit about low back pain. Now, this is from the Lancet in 2021. If you're familiar with medical journals, the Lancet, New England Journal of Medicine, Nature, Science, these are the top medical journals, science journals in the world. So although they do make mistakes on occasion, they tend to be very accurate and high quality of science and research. Now, this one was on low back pain. And what they essentially, it was like a review, and what they basically talked about is some stats. Like, for example, most people have at least one episode of acute low back pain in their lifetime. Usually it's self-limiting, meaning it just will get better on its own, but often it becomes chronic. And studies have found that more than 60% of individuals with mechanical low back pain will continue to have pain or frequent recurrences 1 year after the onset. You wonder why that is, okay? Well, when you injure muscle tissue, this is just one mechanism, but an important one is that when you repair with a lot of scar tissue. Scar tissue is not the same as muscle fibers. Scar tissue has less elasticity, is more prone to tearing, and reduces the function of the muscle tissue. So therefore, it's a weakness, a weaker area. Ever wonder why you keep injuring the same area? It's because that the repair mechanism is incomplete. It's just the nature of the beast, right? And that is a big problem. And believe it or not, if you use light therapy, you can reduce that recurrence. And I'll talk about that. So in this paper, they mentioned there is a systematic review of 165 research papers from over 54 countries, saying that the prevalence of low back pain is about 12%. In other words, 12% of the population at any given time is waking up going, man, my back is sore. That's a high stat. Okay. And the 1 month prevalence is 23%. So in any given month, it's 23%. And it's most common in middle-aged to older women, probably because they do a lot more work around the house than the men do. True. And and especially in the mid-age, 40-ish and upwards into the elderly as well. So the incidence of lower back pain is lower in lower income and middle income economies than higher income economies. That was another interesting aspect. Now, there's lots of things that can cause back pain, disc and nerves and bones and joints and all that kind of stuff. I'm not going to focus on that. I'm going to focus on non-specific back pain, muscles, fascia, ligament. These are the structures of soft tissues that tend to be injured when you're doing things like shoveling snow or things around the house or vacuuming or all those different things that we do, and we don't even think about our back until we've heard it. So that's what I'm going to talk and focus most about. So non-specific back pain, essentially, is mostly dealing with muscles, and they include what's called the deep intrinsic muscles, or the superficial muscles of your back, referred to in general as the erector spinae muscles. They're layered. The superficial layers are very long, and the deep layers are very, very small and short. The deep layers tend to be stabilizing muscles, whereas the large superficial muscles tend to be the ones that cause gross movement, like back extension, for example. And by the way, it's usually those deep ones that tend to be more affected, because they're the ones that tend to be just more injured when you're trying to torque and move and twist your back. So myofascial pain, that's what this is sort of referred to, typically results from overuse, acute stretch injuries like, snow shoveling, tears, diffuse or localized muscle spasm. Lots of different risk factors, everything from more common in females than males, lifestyle issues, sedentary, obesity, smoking. So if you're smoking, stop. If you're obese, now let's be careful here. Everyone, probably has a few extra pounds. We're talking about a lot of extra pounds, right? So you should try and, be within a normal, healthy range, but that's going to fluctuate for people. So don't get so concerned about, oh, I'm 5 pounds overweight or whatever. It's all relative. But it's when you start to have a lot of weight, especially around your abdominal region for men, in particular for cardiovascular issues and so forth, that's what we kind of want to focus on. There's also psychosocial factors that are involved. People that have anxiety, depression, those kinds of things tend to have more back pain, just because they tend to be a bit more focused on it for different psychological reasons. Poor coping mechanisms, traumatic history of traumatic injuries, like lots of car accidents, obviously occupational hazards, all these different things are when you're a little bit more at risk. So some of them you can change, some of them you can't. So when you think about it, think about these risk factors, and the ones you can change, work on. The ones you can't, then you're going to have to deal with that. But a lot of risk factors you can actually work on and change. Okay, so nearly, this is this interesting paper I want to mention, but nearly 12,000 individuals are treated, this is the United States, emergency departments each year for snow shoveling related injuries. Now, given that the United States, only part of it has snow, whereas in Canada, other than probably Vancouver, although they did get a lot of snow so far this year, we get tons of snow. So I don't know what the stats are for Canada, but the most anatomical region for shoveling related injuries is the lower back. So mechanically, this is overexertion, and it may be represented by typically increased joint loading in the lower back. So by that, I mean, these joints are trying to stabilize your back while you're doing this stuff, and those muscles are contracting as hard as they can to keep your spine stable. And when you overdo it, these muscles then can strain or tear, and that's when you get these injuries occurring. This particular paper I mentioned earlier is out of Applied Ergonomics, and it was influence of snow shovel shaft configuration on lumbosacral biomechanics during a load lifting task. And it was a Canadian paper because, we shovel a lot of snow over here. Oh, by the way, if you're listening in and you're not from Canada, let me know in the chat box if you're not from Canada. I'd like to know if that's the case. And if you're listening in from like a nice, warm, sunny climate, I don't want to hear about that. So don't bother letting me know about that. Anyway, the purpose of this study was to compare extension in the lower part of the lumbar spine and angular impulses between a bent shaft shovel and a standard straight shaft snow shovel. Now, they only did 8 healthy subjects, so it wasn't a huge population, but they were able to check all the biomechanics and kind of piece together if these snow shovels make any difference with respect to the stress on the joints. Oh, someone's from Mexico. That's not fair at all. All right. So yeah, you know what? You probably have snow in the mountains. Okay, true enough. So maybe you're up in the mountains in Mexico. Okay, so moving on, here's basically what these two snow shovels look like. One has a bent handle. You've all seen those at your favorite hardware store. And then the typical one is that straight shovel. Well, they went to do crazy mechanical statistical analysis and measured Newton meter force, torque force, and God knows, I have no idea what they did there. Not an expert in that. However, what they found was interesting, is that the bent shaft snow shovel reduced angular impulses, so excessive stress at that lower part of the back by almost 20%. Compared to the straight shovel. So therefore, you should throw away that straight shovel or give it to your neighbor that you dislike and buy a bent shaft shovel. Now, I don't make these. I have no coupon code to give, although I probably should have, for bent shaft shovels, but please do that. It will help prevent low back pain when you're shoveling snow. Okay, so how do you, in general, prevent back pain even without an angular snow shovel? Well, you know what? Most of us don't want to hear the answer to this, right? Because it involves exercise. In fact, exercise is the only proven way to prevent back pain. Not braces, not chiropractic adjustments, not regular acupuncture treatment, not ultrasound, Dr. Ho, none of that, other than proven exercise. Okay, so that is the number one thing I'm going to stress. Now, I'm not going to tell you what exercise is. Go to a physiotherapist, go to a chiropractor, go to an occupational therapist, massage therapist, and get a good program set for you, specifically for you. That's what should be done. Okay, not just come up on your own, because to be honest, you need someone professional to really assess, what you should be doing. So the lack of progress in preventing low back pain, this is, by the way, from the Lancet, could be due to the fact that there's underestimation of non-anatomical aspects that contribute to low back pain. In other words, psychosocial risk factors is the key aspect for that. So I'm going to give you another major tip for back pain as far as how to not just prevent it, but also to recover faster. And it's a very simple one. So now, a systematic review confirmed that exercise alone and in combination with education was the most effective primary prevention. By education, we're talking about things like I'm just talking about, like snow shoveling and, different ways of lifting, all those things that we know, right? Keep your back straight, bend with your knees, don't reach out forward with heavy objects, don't do repetitive torquing of your lower back. All these different things that we need to be educated on or we know about, but they're going to be very helpful. So exercise, education, go see a healthcare professional, understand what the things you can do to help, and do them every day. So how will BIOFLEX light therapy help? Well, it does lots of different things potentially, increasing blood circulation by release of nitric oxide. It can help repair and accelerate repair of muscle tissue that are torn. It can reduce inflammation, reduce edema or swelling, and it can help not only produce collagen for repair, but help it accelerate maturation. In other words, when you have scar tissue laid down after an injury, if you, number one, don't exercise during the recovery process, and you don't do certain stretches or exercises, then that collagen is less likely to mature in correct alignment and mature into mature collagen. And it sticks around as being more immature collagen that is sort of like a spider's web, and that's what makes it so much weaker. So you need to do things that help promote maturation of collagen in the direction of the injury, right? And you can do that in different ways. including light therapy, but also exercises and stretching, and to some degree, manual therapies as well, are very helpful. So that's really what the goal of light therapy is about. By the way, if you have any questions, please just type them in. I'll definitely get to those at the very end. So that's what we're trying to do. Now, BIOFLEX can be used with regular exercise and stretching routine to help prevent low back pain and keep your low back healthy. So in other words, you're feeling pretty good, why would I want to use my personal therapy system? I'm just going to use it when I have back pain. Well, that's probably not wise, because number one, you're going to constantly be doing exercises, right? Regardless if you have back pain or not, because that's really key in preventing back pain. And by adding light therapy, you're actually going to help the health of the soft tissues and the muscles of your back. So you're going to choose the lower back protocol. And again, if you're feeling like your back's pretty good, no major problems, I'm going to recommend about once a week. I mean, you can do it twice a week, once every 2 weeks, but minimally, I'd say once a week would be a good place to start. You're going to choose level 1 intensity. And you're going to place the light pad in 3 positions perpendicular to the spine, starting at the lower rib cage or the lower thoracic region, and then 2 more placements below that to eventually reach that L5S1 or that lower lumbosacral region of the spine where it attaches to your tailbone or your sacrum. So the goal here is not to heal tissues that are injured per se, but to provide ongoing increased microcirculation, keep the muscles and other tissues in an optimal metabolic state through the mechanism I mentioned earlier. And guess what? There's always some lingering inflammation. We're doing stuff all the time, so it will help with keeping that inflammation at bay, and even some micro tissue damage that you're not aware of, it will help to heal that as well, that occurs on a daily basis. So this is what it's going to look like. You're going to choose that lower back protocol. You're going to choose that level 1 intensity. Don't think that the higher the better. In fact, it doesn't always work that way. Start at level 1 when you first use the equipment, and you're going to place the pad. I like to just lean back in a chair against a pillow to keep it in position. That's probably the easiest way of doing it. So that's the first position at that sort of lower portion of your rib cage. And then the next one is just below that. And then the next one is at the very base of your spine. So that will cover what's called the thoracolumbar region, and generally speaking, the area where you have most issues. Now, of course, if you've had issues in the thoracic spine as well, and even the neck, you can treat that as well. But obviously today I'm focusing more on that lower back. So if you injure your back, all right, BIOFLEX should be your first line of treatment for this low back pain. Now, remember, seek professional healthcare advice if you have back pain. You want to ensure there's nothing more serious, right? Maybe you require imaging or medical intervention, whatever, but don't play Dr. Google. There's healthcare professionals here for a reason. They're the experts in the field. Personally, my preference is the allied health professionals, not so much your general practitioner. And I say that because GPs, while they're knowledgeable about low back pain, how they're trained to treat low back pain is through medication and or referral to a physio, right? So, of course, they might recommend exercise or stretches, but let's face it, most of the time they don't do that, or they don't have the time for that, or whatever. That's what the physiotherapist is for, the chiropractor, massage therapist, acupuncturist, the TCM, the kinesiologist, all these different, the naturopath, I hope I didn't miss anyone. Those are the experts in this field. So when you're treating an injury, a non-specific low back pain injury, so this is a muscle issue usually, right? Similar placements that I just mentioned in those 3 positions, you're still going to treat those areas, okay? The goal here is to reduce the inflammation that's created by the injury that occurs secondary to this tissue trauma. And during this acute phase, I think a cold or ice compress is helpful. It numbs the pain. And for the first day or 2 or 3 days, when it's pretty acute, it can provide some relief and it can help to some degree, but only when it's in that acute phase, not ongoing. I would never use heat on an acute low back pain injury. Again, heat promotes blood circulation. And it's actually detrimental to the inflammatory, to helping that inflammation resolve. So if you're in acute pain, you can use the equipment twice a day. Okay, we don't usually recommend this, but if you have a really acute back pain, use that morning, use in the evening, and do that window of about 6 to 8 hours in between intervals for the first few days. And as things calm down, then you can go and treat every day. Usually after a few days, you can go to level 2, unless you're really finding things are coming along great, which oftentimes they do. Keep it at level 1. It's only if they plateau, like, you're feeling a lot better than for a day or two, things are kind of like not improving as rapidly, then you can go to the next level. Okay. And as you're sort of going through this acute into what's called a subacute phase, add gentle movement exercises if tolerable. Personally, I recommend movement exercises from the get-go, unless they're causing spasm or the person can't do it. I'm going to say keep moving. Keep moving. The damage is done. You're not going to damage it more by moving around. You might feel like it is, but it's not. Okay, so the key thing is movement. Keep things moving. Don't just lie there on your back or on the sofa for a day in, day out. That's not what you want to do. That's not what the research says. It's exercise that's most important. Personally, I'm going to say avoid taking non-steroidal anti-inflammatory drugs, Aleve, naproxen, Advil, ibuprofen. Guess what? Research last year out of McGill has shown that when you take those NSAIDs to treat acute back pain or acute pain in general, they actually did it for jaw pain and back pain, I think, you actually prevent inflammation from resolving. Yes, you block it, and it feels great, but the problem is the body doesn't actually resolve the problem. So the tendency to develop chronic back pain, do you remember the stats earlier I mentioned about chronic back pain? Well, guess what? A lot of that chronic back pain is because these people have been taking these medications and they weren't able to actually have that problem resolved. So in my opinion, I'm going to say don't take these medications. They provide temporary relief and they actually don't help to resolve the inflammation, and they can lead to chronic back pain. If you're interested in seeing that research, I did a webinar on NSAIDs versus light therapy. It's on our website. I think you'd find that pretty interesting. The goal during the subacute phase is not only to reduce and resolve inflammation, but accelerate tissue healing. Okay, so very similarly, you're going to place those pads over those 3 areas, or typically the areas that are involved. I like those 3 areas because these muscles are very long, and oftentimes, even though you might feel pain at that very lower part of the back, you might have some compensatory or other issues a little bit higher up. And so therefore, it's also good to treat those areas as well. Lower back protocol, level 1 to start, is what I'd recommend for treating back pain. So within 5 to 7 days of using BIOFLEX, most cases of non-specific back pain will start to improve substantially, typically 50% plus improvement. Now, remember, it depends how much damage there is and what you're dealing with. So, that's a general statement. It's important to increase movement and gentle stretching exercises to avoid long periods of sedentary positions like, sofa surfing, right? Keep it moving, keep it moving. I guarantee you might not like me, but you will get better faster. And again, work with a healthcare professional as well. After a week or so, if your improvement is plateauing, as I mentioned earlier, you can then go to the next level and the next level. Usually you don't need to go to levels 3 and 4. Don't be too quick to jump up to the next level. But sometimes you need to go to 4 and then all the way back down to 1, depending what the scenario is. But usually level 1 and 2 seem to be the most effective, typically. So once you're feeling about 80% plus improvement, like you're feeling pretty good, but you still have a little bit of niggling pain, still treat maybe 2 times a week, maybe 3 times a week until you feel you're pretty much back at your pre-injury state. And again, every time you injure your lower back, it's a little bit weaker for the reasons I mentioned earlier about scar tissue and how your muscles repair. And essentially, it's less elastic, less flexible, which is why you need to do your exercises, Pilates, restorative yoga, all these different things that you can do are going to be extremely helpful in preventing recurrences of back pain. So if BIOFLEX is administered quickly after a low back pain injury, you can literally do it the same day. Then you're going to reduce the scar tissue accumulation, and this will lead to less back weakness as well. Regardless, once fully recovered, okay, continue with a well-designed strengthening and stretching program for your lower back, okay? And remember, exercise is the key to a healthy spine, okay? That's it. You have to do exercise. Don't rely on medications. Don't rely on laser therapy or light therapy. Do the exercise. It takes 10, 15, 20 minutes a day, part of your routine. It's very beneficial. And don't, think that if you don't do these things, you'll be okay, because we know that there's a high rate of recurrence for back pain. All right, wonderful. Thanks for attending, everyone. My next webinar is geared towards healthcare professionals, but everyone's welcome to listen in. And similar theme is lumbar spine muscle injuries like I did today. So it's going to be a little more in depth and focus a little bit more on using our professional systems to treat this as well. So I'll talk a little bit more about protocols and that kind of thing as well, and get a little more in depth into the science as well. And that's on Thursday, January the 26th. Again, as usual, these are complimentary webinars. As long as you register, you can get an email to watch again. And we are having new events. We have an in-person event in Vancouver, if you're in that area, from 9 a.m. to 3 p.m. Guest speakers include Dr. Lauren Brown, acupuncturist and expert in fertility, as well as using photobiomodulation in his practice. He's a world-renowned lecturer. And Dr. Pierre Delorier, a chiropractor from White Rock in the Vancouver area, who's been using BIOFLEX for over a decade now and getting tremendous results. A wonderful speaker, very dynamic, a great guy. So hopefully you can make it that out, and you can sign up on our website as well. And I do monthly online 2-hour Light Up Your Practice webinars, more geared towards healthcare professionals to integrate laser therapy into your practice. The next one is February the 4th. It's on a Saturday, 10 a.m. to 12 p.m. So it's not too much of an investment in your time, and you can register online as well. Wonderful. Let's take a look at some questions that you might have. First one was at the very beginning. Can it be used to treat osteoporosis symptoms? Symptoms, yes. The actual osteoporosis, yes and no. Yes, theoretically, no, because getting light into the bone is problematic. Research has shown it can help it can help osteoporosis in rats and animals where you can get the light into it, but in humans it's so hard because the bone is so dense and there's muscles around it and everything, especially the spine and so forth. That's what makes it challenging. But osteoporosis leads to symptoms because of degeneration of the spine and all that kind of thing, and so therefore this can be helpful for that. Are there any negative long-term effects for using the BIOFLEX laser system regularly or maintenance care, and can one overuse it? So I think I addressed that earlier. I actually recommend that you use it on an ongoing basis, but you don't necessarily have to use it as much as when you're trying to deal with an injury. But if you have a chronic progressive issue like arthritis, you're going to be using it more regularly, 2-3 times a week. But if you have a flare-up, you're going to be treating every day or maybe twice a day kind of scenario. A patient, someone's mentioning a patient with neurogenic claudication with associated spinal stenosis. Any suggestions or recommendations I can provide this patient in regards to using his personal BIOFLEX laser? Yeah, so obviously that's a fairly serious issues. Eric, what I'd really recommend there is consistent treatment, in and around the spinal stenosis area, and to probably come in on a regular basis for the laser portion of the treatment to drive light deeper in towards the nerve roots and the spinal cord as well. a question here from Natalia. Does the McGill research on NSAIDs also apply to Tylenol? So the research was non-steroidal anti-inflammatory drugs. Tylenol is not an NSAID, I believe, right? It's just a pain blocker. I don't know my drugs, to be honest. So it had to do more with anything that blocks inflammation. An NSAID, that's what the research was on. A question here from Jeff. You mentioned avoiding NSAIDs with an extreme acute episode. What are your thoughts on the use of adjunctive muscle relaxants and or narcotics for pain management to allow for better movement? Okay, a couple of things there. Your body is going to, the pain is there for a reason, right? The pain is there to tell the patient, oh, don't do that, right? So if you do a muscle relaxant or, an opioid or whatever, the person actually may have this false sense of what they can or can't do. And that might prolong things. Now, the thinking about opioids now to medical doctors is only prescribe them in severe acute pain and only for a short term, 3, 4, 5 days. That's it. No more opioids at that point ever. Do I have a problem with that? I guess it depends on your pain level or pain threshold. To be honest, most people, if you focus on getting through that pain, and believe me, I've had severe back pain, you can do it without drugs. Only once did me personally falling off a roof that I had so much pain that I actually took a few narcotics for a couple of days, but that was like off the Richter scale because of fractures and all the rest of it. But in back spasm pain, although it can be so severe, if the patient can somehow tolerate that, you're better off without it. But if they really truly need it, then sure. That might be for some people to get them through that. But you need to make sure they're on the same page about not doing things they shouldn't be doing so early on by temporarily blocking the pain. What is the best setting for thigh pain? So I'd use the hip protocol. There's a little button that shows the hip. Being such a big, thick area, that's also effective on the thigh, on the quadriceps and the hamstrings. How about treating back pain that's associated with trigger points? Same thing, myofascial pain, trigger points is myofascial pain. So very similar advice I just gave. Can a chronic injury, probably with considerable scar tissue to the external obliques, so in the abdominal region, along their attachment to the ridge of the hip, be successfully treated with BIOFLEX? So here's the thing with chronic scar tissue. The body has the capacity to help reduce the amount of scar tissue, even if it's years later. Of course, the best scenario is right after an injury. So to answer your question is, it would be helpful, but you have to have a realistic expectation that there's still going to be issues there because you're not going to it's not going to like dissolve all the scar tissue. What it helps to do is modulate the fibroblasts that secrete collagen, help mature it in that area, along with some other things like, maybe ART and other things you might do to help. So if you did all that, it would be helpful. In isolation, it would still be helpful, but I'd recommend doing other things. But the expectation level is what I'd be most concerned about, right? Okay, thank you so much. So I do see questions under the chat function. Ultraviolet B and vitamin D as well as vitamin K2 supplement. I'm not really sure I understand that. Narrow band ultraviolet. I don't understand why you would use that for back pain. Vitamin D, okay, and vitamin K2 supplementation. Again, I'm not quite sure what the relevance is there. Sorry, Alan. A question here, I have a personal system and use it on T11 fracture. Use on the 3 positions you illustrated, ? And should I be seeing a professional for deeper penetration? Yeah, so for a T11 fracture, I would do just above and below that fracture point. So you wouldn't have to do it at that very lowest level. So probably 2 placements over that area would be beneficial. Yeah, if you're able to get into a professional that has the laser portion, that would also be helpful as well. You will get indirect effects, but that light's not going into the bone. Well, not a lot part of it, because it's too difficult to do that. A point here about a weight bearing and weight training. Oh, to reverse osteoporosis. Right. Now I understand it. Yes, I agree. With respect to osteoporosis, vitamin D and weight bearing exercises definitely would be what's highly recommended there for sure. Okay, wonderful. Thanks everyone for joining me today. I appreciate your time, and hopefully you'll join me for the next webinar if you have any interest. And next month in February, the topic is slip and falls. I'll be putting the can see the theme here, right? I'm actually, I live in Creemore, which is north of Toronto, and we have a bit of an ice storm happening today. So it looks extremely slippery out there. So I don't know if everyone saw the TikTok videos out in Seattle with that ice storm. So man, I tell you, we should have set up a BIOFLEX booth out there. Slip and falls. So I'm going to talk about how to treat bruises with BIOFLEX, and how to treat wrist sprains and fractures, which occur in slip and falls a lot, using BIOFLEX as well. Thanks again. Have a great day, everyone. Again, Happy New Year, and best of health in every capacity in 2023. Take care.